Welcome back. Now, people who went missing during the first lockdown were deemed more vulnerable and at a higher risk of harming themselves or others. Researchers worked with 6 police forces across the UK to understand the impact of lockdown on missing people. Their report found that adults who went missing during this period were more prone to mental health issues, domestic violence, or had a history of self-harm. Well, Dr. Karen Shalliff-Green is the director of the Centre for Study of Missing Persons at the University of Portsmouth and joins us now. Good morning to you. Could we start by talking about the good news, I suppose, and that's that there has been, because of lockdown and because of COVID, a very significant drop in the number of missing children and adults.
Absolutely. We saw about 35-36% reduction in missing persons report. So that is good news. There is also the possibility that people refrained from reporting to the police incidents because of fear of backlash or being told off. As we see now, if people exercise a bit further away from home, they might be told off for that. So there may be a higher number of actual cases that were reported, but certainly it was a significant reduction.
Those who did go missing, as I was reading in the introduction there, they're in the particularly vulnerable category. It's not easy to go, or it's a lot harder to go missing, isn't it, during a lockdown? What sort of circumstances are people fleeing?
Quite severe, and we were expecting that because missing is a symptom of something not quite right in a person's life. There's a reason why they go missing. And so some of the vulnerabilities were people who were are transgender, people who are escaping violent, racial abuse, domestic abuse, people with mental health. We know that the lockdown triggered, in some cases, mental health issues. Even sometimes possibly from crowding. If people were locked in a very crowded space and just needed to get away, that in itself is detrimental to their well-being and can trigger or be linked to mental health issues.
And children going missing from care remains a particular concern, and I can see that the report also highlighted that children were more likely to be classified as low risk during lockdown, which is going to be counterproductive, isn't it?
It is. We're not sure as to why. There were some suggestions, for example, that it was due to the lack of ability to contact family online. Maybe care homes weren't quite set up for that yet, and so children went back to their families, which would explain why they were more likely to travel further distances than they normally would. It could be that they weren't classified necessarily as they normally would due to lack of resources, due to a lack of understanding of some trigger points. We don't know. That's the answer to that. But it's certainly something that we ask forces to look at, thinking of second, third lockdown.
Yeah, talking about asking forces to look at it, I'm curious to know, during a pandemic and during the last 9-10 months that we've had, how does the communication network between social services, local authority, police, how does that hold up? Because when you see Jason's report there and seeing that, you know, kids are still going missing because of county lines, I just wonder how all of that network has changed due to the pandemic.
I'm not an expert in that, but my sense would be is that people have transferred to online discussions. So whereas they would attend meetings, potentially multi-agency meetings, they would do that either by phone or online. The need is for a multi-agency response. It's not just the responsibility of the police, social services, local authority, health officials, as you showed in the piece, education, are all part of that. Services that can identify problems and also assist in identifying possible solutions. So if you're talking about care, for example, if there's inappropriate care situation, it's not the responsibility of the police. They might liaise with social services or local authority that are responsible for that placement to try and adjust that. But of course, everything was very, very difficult during that time and still is.
Yeah, indeed. You can speak for the whole population in that comment there. Dr.